Hello, and thank you for your interest in our poster, Trends in Use of Rehabilitation Services versus Hospital Readmissions. Hospital readmissions for patients with diabetes presents continued healthcare challenges in terms of patient recovery and medical expenses. We became interested in this research because there is limited evidence that addresses rehospitalization trends as related to home health rehabilitation services for patients with diabetes. Admissions to home health care in Texas is most often performed by a nursing professional, which possibly limits rehabilitation home health services utilization. The purposes of this study were twofold. One, to explore the Outcomes and Assessment Information Set, OASIS C2, database sponsored by the Centers for Medicare and Medicaid Services, to characterize hospital readmissions as related to diabetic diagnosis. And two, to determine if the medical professional assessor at home health services is related to rehabilitation home health services utilization. This was a retrospective cohort comparison research design for Medicare beneficiaries with diabetes who received rehabilitation home health care during the first 60 days after discharge from hospital inpatient care. A database request was made and approved for a randomized sample data set of 5 million centers for Medicare and Medicaid service beneficiaries that included the OASIS, Base Claims, and Revenue Center. Data analysis included descriptive statistics, MANOVA to explore group differences, and predictive forest regression modeling to describe and model predictive trends in the data. Variables of interest included beneficiary demographics, diabetic diagnosis, start of care, medical professional assessor at home health services admission, number of rehabilitation home health visits, limit length of care, emergent conditions, rehabilitation services versus no rehabilitation services, and hospital readmissions disposition. Figure 1 illustrates the HHA project data mining strategy that allowed beneficiary demographic data match with type of visits claimed and actual total number of rehabilitation visits utilized. As depicted by Figure 5, we had a large sample size of over 117,000 total visits that included both rehabilitation and non-rehabilitation care. Figure 6 demonstrates the over 5,867,000,000 episodes of care, which included both rehabilitation and non-rehabilitation care. The predictive models suggested significant increased probability of hospital readmission with the no rehabilitation group. 75% of the start of care assessments were performed by registered nurses, with only 23% performed by physical therapists. Rehabilitation number of visits and age were significant predictors of discharge disposition. We concluded from these results that patients with a diagnosis of diabetes had significant hospital readmission from home health services. Additionally, patient readmissions to home health services were primarily performed by a nurse rather than a rehabilitative home health professional. This was directly related to rehabilitation, home health services utilization, and discharge disposition. Again, thank you for taking interest in our poster concerning trends in use of rehabilitation services versus hospital readmissions.